that causes pits in the lining of the sinuses. And then those pits fill up with mucus and they get secondary bacterial infections. And that's what causes the infection. But the root cause was the exposure to the fungus. So if you just treat with antibiotics and steroids long term, you don't get them well long term. And so you have to find the source of the fungus environmentally, get rid of it, and get rid of it in your diet as well, and then you get long-term wellness. So that's what this is all. I've got a lot of slides to show you. And so what we've come up with is a way when these people are very sick and the mycotoxins are in their sinuses and the spores are in their sinuses, the spores continue to make more toxins. And the toxins in 20% of the population will, like they got defects in their MTHFR, they can't methylate B12 or any combination of that. So they can't excrete the toxin like 80% of the population can. So
when you have
the
mold, when you have the mycotoxins, you're not able to detox the toxins.
They can't excrete the toxins that the mold is producing. So
because why?
They can't methylate B12.
Okay.
There's all kinds of shoot-offs of MTHFR, but the basic premise is they cannot excrete toxins from their body as quickly as all the other people can. So they get the symptoms. So they get cognition symptoms. They can get heart symptoms, heart arrhythmias. They can have Alzheimer's type symptoms or symptoms of Parkinsonism, hearing loss, vision defects, balance defects, immune suppression, autoimmune diseases. All these things are offshoots of fungal exposure in this patient population. So if you don't fix the diet and the air, you can't get to the root of the problem and all the treatment fails. So you get 100% failure rate if the patient's still living in mold. The surgery has absolutely no value. So, because they're breathing 3,000 gallons of air a day, that's the point. But you're only washing out with 8 ounces of saline a day, so that you can't beat 3,000 gallons of air if the air is bad. So you got to fix the air first. And that's a hard thing. In some houses, you can't really fix very well. You just have to leave and get in a safe place. What I tell the patients, if they're having severe neurological symptoms, like they can't walk or the visual defects or cognition defects, it's best to get in a safe place where you're improving, you're getting better, and then deal with the home or wherever it is from afar, so you're not still in it. That's the way you get well quick, because you're trying to preserve your brain function. So it's more of like an emergency situation. You want to get out of it as quickly as possible and not wait around in it while you're trying to fix it.
Yeah. So you're saying once we identify that we have exposure to mold via what we're breathing in or what we're ingesting of moldy food, that we can be exposed to mycotoxins, but some people can tolerate mold more than others, and some people have more susceptibility to it because of their genetic methylation factors, and so other people get more mold toxic exposure symptoms than other people.
That's right. And so you got two different things that are not related. One is chronic sinusitis, and the other one is inability to excrete toxins. So they're not related. So you can have both of those, and some people do. So the gene that makes you have chronic sinusitis makes you have an immune reaction to mold in your nose. And the reaction causes the pits in the lining of the sinus. And the pits fill up with mucus, and then bacterial overgrowth occurs, and then you get an infection. So everybody's chasing the bacteria instead of the fungus. So if you don't kill the fungus, the bacteria keep coming back because you haven't resolve the pit in the lining of the sinus. I got a lot of slides to show what that looks like.
You want to share?
But
when you're ready, you can share when you're ready. I think it's just trying to, I always like
Okay.
to ask why. So I might ask a lot of questions because I like to understand the mechanism of action of why is that. So I'm the annoying person, but the bacteria is built up because of the immune reaction to it from the fungus. So there's bacteria and there's fungus, and then you'll show us some pictures
Right.
of the pits. But yeah, so share slides if you're watching the video version, and you can share the slideshow.
Can you see that?
Yeah, can you do full slideshow presentation so you can have it bigger screen of the
Sometimes
slide? Is it PowerPoint? There you go. Perfect. All
you see
right.
that?
Yes. So this
All
is,
right. So this
tell us
is
about,
a eczema from which is an immune reaction to fungus that this particular individual has. And so he had surgery, and 2 hours after surgery, his skin clears up because we removed all the toxins in his sinuses that was causing all this. So this is 2 hours after surgery. This is
oh,
dramatic.
so
I
two
had never,
hours. That's amazing.
I had never seen this happen before before this patient. So this proves that all of his dermatologic symptoms were coming from his immune reaction to fungus. All right. So, and then this is another one. These legs here were severe dermatitis here, psoriatic dermatitis, and this is 6 to 8 days after surgery. These legs over here. So this is the maximum dermatologic treatment for these legs. This is the best they could get. But if you look at this X-ray on the left, the gray stuff is polyps inside the sinuses. The sinuses are supposed to have all black in there. And this white thing is a fungus ball inside the sinuses. So when we cleaned all that out, and then we put some on a SDA agar plate on a mold plate. So this is the tissue from her sinus. And you see this brown halo coming off of that tissue. This is about 4 days later. So the brown is the mycotoxin leaching out of the tissue. So both the tissue and the brown halo uh, assay for the same mycotoxin. So we know that brown halo means it's a mycotoxin now. So you don't have to keep testing it. So this is what was causing this. The
Wow.
mycotoxin causing the skin problem. So this is her face before and after. So you can see this is her hand before and after. So this is very striking, and really the dermatologic folks haven't seen a turnaround this fast because they're using steroids and stuff to stop the immune reaction, but they're not removing the cause, which is in the nose here.
Mm.
So once you remove the cause, then you get this kind of result.
So give us a little bit more information. You're a doctor in ear, nose, and throat, and you started to see patterns of people. Talk about how you came up with the correlation of skin issues, and we'll talk about brain health due to mold exposure, putting mycotoxins into the body.
Well, it was a long time coming. So you see patients, and then if you get results like this, and then you try to figure out why that happened, then you take the tissue out of the nose, and you know this person had a mold exposure because they give you that history when they come in. And so we know that something the mold is making is doing this. So we did a urine test. The urine showed that this patient had 5 out of 5 mycotoxins in the urine. So if you breathe them in through the nose and they come out in your urine, where are they? They're everywhere in your body, right?
Yeah,
And including
in
your
one
brain.
end.
That's right. And it's in your brain as well. And we can show that on artificial intelligence software. We can show the mycotoxins in the brain now. And I'll show you that later. And that's new, and that's not out yet. I haven't published that paper yet, but I'll show you what it looks like. Anyway, so this is all mold and polyps inside of the sinus. These are the eyeballs up here, and this is what was causing all the skin problem. So this fungus was secreting these mycotoxins, which is the brown halo, and the mycotoxins in the mold were causing this skin reaction.
Yep.
So when you remove all that stuff from the nose, a week or so later, you get clearing of all the skin, because that's
And
why she.
and then going back to what you said, the mold testing for mold, a lot of people don't know they had exposure to mold. So you're saying a lot of people come to you saying, I know I had some mold exposure, or they come to you because they have these weird symptoms they can't
Well,
figure out.
we kind of give them some homework to do before I see them, so we'll know if they're compliant or not, and then we know before they even come in if they're having a mold exposure. And so the way we do that is we have them get a urine mycotoxin level before they ever come in. And that if it's positive, then they're getting mold exposure, 100%. And so then they've got to figure out where it's coming from, and they do that with mold plate testing. They can do that themselves. And most of them already know where it's coming from. So then you've got to get some professionals to help you clear it up. And we use two different companies here that they go other places in the country to fix it, because there are a series of things for human health that all of the remediators don't do or don't know how to do. And so it's really important that no toxic chemicals are put in the house, because a lot of times they'll do toxic chemicals in the house, or they won't find the cause where the water leak is and fix that before they start tearing everything up, you know. So yeah, but you got to get your house fixed. Now, if you have severe neurological symptoms, you know, like you are having trouble walking or seeing or hearing, you really should get out of the environment so that you know you're getting better. And then you can address it from afar, but don't stay in it, because you're still hurting your brain when you're doing that. So I'll show you something. So this is an example of fiberglass. All these red spots are thousands of eosinophils, which are white cells coming in to destroy a fiberglass particle upon which a mold is writing. And so only 20% of the population react like this. So all these red spots, now the cilia don't work in those spots. And so they'll get pooling of mucus in these little pits in the lining. And that's what causes the chronic sinusitis.
So
this,
these pictures of the sinuses that these
this
are.
is inside the maxillary sinus, which is the one in the cheek. Inside the sinus. This is a scope inside the sinus showing all this. And then you got this one's even more severe. This right up here is normal tissue. That's a light reflex there. And all this hemorrhaging underneath the tissue is eosinophil reaction to the fiberglass that patient's breathing. And this big round thing here, this is the eosinophils dissolve that tissue down to bone. So there's exposed bone in the sinus with a scab over it. All this is bone underlying this. So it's destroyed all the tissue in here trying to kill fungus. So you can't have fiberglass inside your duct system if you're a mold patient, because you'll never get better. So mold likes fiberglass. It rides on fiberglass. So fiberglass is lining many, many millions of duct systems in the United States. It should be wrapped around with aluminum foil on the outside of the duct, not inside the duct. So that's what caused this problem.
Wow.
And this is common, you know. So this is for fiberglass. See how the fiberglass in the air? We have to have a light to see it. But all this fiberglass is also getting in the duct system, and they're breathing it. And so then they get sick. So this is yeast. This is candida, which is yeast inside the nose. And this is after we treated the air, you know, got the air count down to close to zero fungus. And then the drugs work because you're not continuing breathing it. So this is putting antifungals in the nose, getting rid of the candida in the nose here. So one on the right is after killing it with antifungals, amphotericin, citrodrops, and GSE. And
So
then,
go for a moment though on how's the relationship of candida and mold?
so candida, so mold is a fungus. All right. So under the fungi, you have mold and yeast, right? So yeast is a fungus. So they're all in the same family. They all have the same cell wall structure. So they all do the same thing inside the sinus. So if you are sensitive to one of them, you'll react to the other ones eventually. So you have to get rid of all of them. And so this is normal tissue here, and this is all candida inside the nose. So you got two things you got to do. You got to get your air clean and your diet clean. Both of those are producing fungus in the air. So the air is the most important because there's more volume. And then secondly, if you're eating all your carbs, your bread, rice, potatoes, and sweets and sugar, you overgrow yeast in your gut, and the yeast produces gliotoxin. And so you've got to eat a candida diet, which is like all your meats and seafood, all your veggies and your fruits or berries. And what you're eliminating is all the white stuff, all the sugars, bread, rice, potatoes, sweets, and alcohol. You're eliminating those things. And then you can kill the yeast. But if you don't stop eating sugar, meaning the carbohydrates that are refined, you cannot get rid of yeast because you make them resistant to the antifungals because you change their physical shape. They change into an invasive hyphoform. Hypho are like roots that go down in your tissue, and they're 3 feet long, and they make you resistant to all the antifungals. So it's
Wow.
not that you're resistant to the drug; it's that you're eating sugar, and you can't kill fungus if you're eating sugar. I don't care what you take. You know?
Yeah. So going back to you said we get yeast overgrowth in the gut, and then how does that candida overgrowth, yeast overgrowth get into the nasal passages?
Well, they also have it in their air, because they're breathing it through the air. So
Okay.
a lot of patients, if they do mold plate testing, they'll have telomeres to count yeast in their bed, which is coming off their skin, and then they're breathing it.
Yeah, that's awful.
So
So
go
are you
ahead.
testing with the mycotoxins, like, similar to organic acids test to get this data to see if there's overgrowth and mold toxicity?
No, we just do a urine mycotoxin. That tells you everything you need to know. If they're positive, they've got a toxic environmental situation. So you got to get the air right and the diet right. Once
Mhm.
you do that, then you can kill the fungus. But I think half the people will get it right, the other half won't. But at least they have the information to know how to do it.
Yes.
So,
Well, it's like
so
we say, you keep putting gasoline on a fire if you don't change what you're doing. If you keep
that's
eating
right.
sugar, trying to get rid of the candida yeast overgrowth, but if you keep continuing the way you eat, you can't fix the problem if you keep throwing it in there.
Well, that's right. Now the brain loves the sugar, but you got to give it sugar with protein, so it's a more level release instead
Mm.
of peaks and valleys. You have a constant release over the day with protein. So that's a better way to get it. And complex carbs, all your vegetables are complex carbs. They're fine. So it's not that hard of a diet once you get used to it. Uh, but who doesn't like meat and fish? I mean,
We're
if
all
you're
about our meat here. You're on talking to the right people. We're all focused on that protein.
that's right, and you can be a vegetarian too. But what happens in a vegetarian diet? That's a good diet. It only if they eliminate the carbs. I mean, the refined carbs, the breads and all that stuff.
Yeah.
So they tend to eat more refined carbs than other people. But the ones that get educated don't do that anymore. You can still do it, but it's better to have a good protein diet. Now, you don't want to overdo it in 60 grams or something like that, but 20 to 30 is fine usually, in a day, grams of protein. So this is another yeast picture. All this white stuff is yeast, and this is after we got the environment cleared. See, the environment's really bad over here. All the mold plates are full of fungus. And now we got the environment right. And so then the medicines actually work when they stop breathing this stuff. See, this is all clear. So this was all that same slide. So this is all yeast in the nose, and all the antifungals are not working because they're still breathing it. So we get the air cleaned up and the diet cleaned up, and then it stays clear. That's a light reflex. But that's normal.
So these people had to tear apart their house and rebuild rooms to get that number down.
Yeah, it's kind of all over the board. Sometimes it's so bad you got to leave and fix it while you're in a safe place. Sometimes it's just one or two areas that have a leak. You got to fix the leak first and then take out everything that got contaminated. And then that has to all be done in containment by professionals who know what they're doing. It's not something you want.
Yeah, but the plates you're talking about, people might not know about that. I've talked about that years ago in a podcast, but just those little plates you can put in different rooms, and they're what, $30
Yeah,
to
so
buy
you
one?
can on Microbalance Health products, we have those plates that you can get, and you put them out, and then you just count the colonies on the plate. Normally it's 0 to 4. If you got like 30 or 40 colonies, you got a really significant problem.
Okay.
And if you want to get it assayed by the lab, you just send the plate to the lab, and then they'll test it for you. But this is place that, you don't have to be a rocket scientist to know this person has a bad environment. See these places over here. You don't have to have all this other data. This place has got too much mold for me to live there. Okay, that's what you know. And so you got to start addressing that. And they have this big fungus ball that are sphenoid sinus. See this white thing? This is when fungus secrete calcium salts when it metabolize food. So this means this is a fungus in the sinus. So you see all of this fungus came out of this sinus right here. This is aspergillus. It's a huge amount of fungus. And it was draining down into the lungs and making this patient have a fungal lung infection. So she was allergic to all the antifungals except amphotericin. So I got the pulmonary guy to do a bronchoscopy and treat each of the bronchi with a dilute solution of amphotericin, which makes the fungus release from the lining and come out of the lungs. And so after doing that and operating her, she got well, but she couldn't take any of the azole oral. She was allergic to those. So this is the only way she could get well, by using amphotericin. And
Just
of
clean
course
it out.
she got the house fixed. It was all in her house. So
that previous slide, it said it was in their car.
yeah.
That people have mold in their car. So you need to test everywhere.
That's right. The typical places for mold besides the house is the car, the office, and the washing machine. All of the front loaders are full of fungus. You can't really fix them. So the one that we like people to get is called a Speed Queen TC5. And I don't sell washing machines, but that's the one that we've tested. It turns out to be the best one.
Wait a minute. So people are getting mold from their washing machine. So would they be wearing it, or how do you inhale mold from your clothes? How does that work?
So if you got it in your washer, that means you're sleeping in it and you're wearing it. So sleeping in it will get into your nose, right?
Oh my gosh, how do we not have mold everywhere? It's crazy.
So now 80% of the population can live in a toxic environment that will kill the other 20%. Now that's not good for them. They'll still get a little fatigue, but they won't mark that off as a problem. So it's actually hurting everyone, and the incidence of cancer is really high with chronic fungal exposure. So the mycotoxins are known to be carcinogenic. So a long period of time, the exposure with a large amount will increase the incidence of getting malignancy. Now, everybody won't get cancer, but it increases your chances of getting it, So this is important. So this patient, I'll play this.
This is patient Linda Stanley, who has noticed vertigo and cognitive dysfunction. Can you tell me what happened to you?
I was on an airplane on Thursday, flying 2 times that day, and later that night, early the next morning, started feeling dizzy, vertigo, fuzzy head, impact on my sinuses.
And then what happened to clear it up?
But today, when you did this procedure,
With amphotericin into the sinus.
it immediately cleared my head. No more vertigo, no more fuzzy thinking. My sinuses opened immediately.
Okay, so if you go back, this slide right here is showing me this. She's had surgery before, so I can put this amphotericin with a scope directly into the maxillary sinus. This is the maxillary sinus here, and that stuff coming out of there is amphotericin out of the syringe. So we'll just fill that sinus up with amphotericin, and then after we did that, her brain cleared up within about 30 minutes. So I wanted to see what that looked like. So this is acute EEG. You know what those are? Acute EEG.
Yes, but maybe explain them for people.
Yeah, go ahead.
Well, no, you explain it, not me.
All right,
You explain it there.
So this is a measure of the voltage inside the brain. So high voltage is a disorganized thought process, and it's red. And normal brain function is green and yellow. Okay, so we have the patient like this. We did the acute EEG when they have cognitive issues before we put the amphotericin in the sinus, and then this is after we put the amphotericin in the sinus. So that they're given a history that their brain cleared. What I wanted to see what that looked like on acute EEG. You can see it really does change the voltage in the brain. And so red and orange is all high voltage and disorganized thought process. So that's pretty dramatic, isn't it?
That's incredible.
So this is called a P300. Now that's a hearing test where you test the time it takes for the sound to get from the eardrum into the brain. So normal hearing time is 300 milliseconds. Well, these people are 400, 500, and this particular individual has no response. Because I notice in the patients, when you're talking to them, if they're not writing down what you're saying, telling them, they don't get it because their brain never heard it. See, so these when the green and red lines cross, the brain has then heard the sound. Okay, well these never crossed. So this person is hearing the noise, but they're not processing anything. All right. So then this one has a 461 of 300. So they're crossing way out here. So we found out that if we're not having these patients write down their instructions, they don't own it and they don't follow up. So you can give it to them all printed out nicely in a paper. They don't own it then. They only own it when they write it. So we have them write it down.
Wow.
So now this one is all this is tissue that we took out of the sinus, and all this brown halo is mycotoxins. And this is what the toxins that were in this tissue, aflatoxin, ochratoxin, in this tissue, and it was both in the tissue and in the halo. So the same mycotoxin is leaching out of the tissue. So now we don't have to keep assaying the brown halo because we know it's mycotoxins. Okay. So this is what CT looks like. This is the tissue that contains all the mycotoxins and the mold spores. And then this is what this patient had to say. She didn't want her face on there, so
my symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressants, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
Okay, so
Oh,
how many millions of people are out there
yeah.
that are having psychiatric issues, you know? And so that's just an example. And her sinus x-ray is not that bad, but she really needed the surgery. And what you do is you do all the medication, get them out of the environment. If they don't improve their scores, you know, their cognition score and their energy level, and they still have a large amount of mycotoxins in their urine, they need surgery, which removes all that. So, and this is that same patient that you just saw. This is before surgery. All this red stuff is disorganized thought processes and brain damage. All right. So this is after surgery. It's much better after surgery, but it's not clear. Now, this is after neurotherapy. So a lot of these people need neurotherapy after surgery to get the rest of it cleared up.
What's
So,
neurotherapy?
It's passive. It's like you're putting electrodes on the head to measure the brain waves, and then the computer knows what normal brain waves are supposed to look like. So it shows a movie, and then the brain gets engaged in watching the movie, and then the movie turns off. So the brain starts making all the waves it knows how to make until the movie reappears, which is the correct wave. See, so it's getting rewarded by doing the right thing. So the brain's getting rewarded to see the picture, and then it stays on the correct frequency. See what I mean?
Yep. Interesting.
And then you keep doing that, so you retrain the brain. And it takes about 3 months or so to do that. And you work with it, you know, about an hour a day is passive, and you can do it at home.
Is that
But
similar to neuroplasticity, retraining the brain?
yeah, you're
with
retraining
neurotherapy?
the brain. This is from brain injury, you know,
Mhm.
and you're retraining the brain, and they get a lot better. And then some people have they think they're still in mold, and they're really not. And they throw all their clothes away and move to another hotel room. And they keep doing that because of the brain damage.
Mm.
And if you don't fix the brain damage, you can't change the behavior. So eventually they just empty their wallet and they never get any better. So
Hmm.
you got to know what's happening in the brain, and also that when you do a tap test on their clothing, you know that they're in a safe place because they don't have many colonies in their clothes. See, so that's what we do.
Okay.
So now,
Interesting.
so this is tissue taken out of the sinus. This is this tissue right here. That little white spot indicates it's most likely fungus, because fungus secretes calcium salt when it metabolizes food. And so we clean all that out. This is what we get. And that has mycotoxins in it, just like we talked about. And so this is a normal piece of tissue in a patient who doesn't have a mold issue. And you see it doesn't have any mycotoxins coming out of the tissue. So this is the control. There's no brown stuff coming out on these patients. And this one has that. So, and this is the called cyclone. This is what we put inside the sinus that does a 360 irrigation and sucks at the same time. And that's what makes this work. After you open the sinus, you have to wash it out. And
So that's what it looks like.
this is a high pressure device. He'll show you in the next picture what it looks like. See how this is how fast it sucks. So none of the toxins go in the system when you clean it out. And this you put this under high pressure, so it's like a pressure washer inside the sinus. And so it gets rid of all the stuff inside the sinus. And this is what it looks like in surgery. So,
You're sucking it out.
well, you're irrigating and sucking at the same time. So you're irrigating all that tissue. And this is before, and this is just what a face looks like before and after. This is like a month later. This is kind of a dramatic facial change. See?
Yeah.
And this now This is a recent one. The reason I'm showing this CT scan is totally normal. There's nothing wrong with this CT scan. But the patient wasn't getting any better, and they were in a safe environment. Their diet was perfect. So those are the patients that need surgery. So we had to operate on her.
What has been your experience after your mold exposure?
Very life-changing quality of life. Before I started, my cognition score was probably like 1 to 5. It could be lower on some days. A lot of days I was very confused. I had a lot of pain, a lot of tingling sensation in my face. I couldn't bend over. Just the quality of my life was not. I'd say out of a score out of a 10, it was probably like a 4, 3 or 4. Today, a week after surgery, I mean, I have definitely improved. My mental clarity after I woke up after surgery was completely different. I haven't felt that in years. My energy is coming back. My brain's coming back. My brain fog has almost completely disappeared. My memory's coming back. My vision. And most importantly, like the pain in the center of my head is no longer there. That's something I didn't think I would ever get rid of. That was causing a lot of the pain and the pressure. But it's pretty much completely gone, and I'm completely satisfied with the surgery. I wouldn't change it.
Okay. So
This is 3 weeks post-op. What is your experience?
Well, before my surgery, I had a bunch of floaters floating around my eyes, and my vision was, pretty blurry and sort of discolored. And post-surgery, my floaters are gone, and my vision is kind of a lot clearer. My energy level is now a 7 instead of a 3 before surgery, and my brain function was a 3, and now it's a 7, and gradually getting better.
Thank you.
So what do
so-
you find, we're sharing all these videos, just explain to listeners, there might be listening, watching this video because they feel like they might have some unexplained symptoms that could be related to mold. They're struggling getting results with what they're doing, but why are we showing all the videos, and what do you think the meaning is, what your mission is for this, to help people understand it all?
Well, you got to do all the medical stuff to try to get the toxins out of your system. And, but sometimes, once you know that your environment is clear and, by mold plating testing, and you're feeling better in the environment, but you're still not moving ahead, and that you're not eating sugar, and you're still not moving the needle, it's going to be one of 3 things. It's your diet, your air's still bad, or your pituitary is damaged, which is a whole nother thing. Most of these patients have pituitary damage, but the fungus comes in through your nose, so it sets up resonance in your sinuses. And this CT shows that. He's got obvious fungus in his sinuses. So if you have it in your sinuses, either the mycotoxins or the fungus or both, then you've got to get rid of it in order to get better, because you've got your own manufacturing facility inside your sinuses. So even if everything's perfect, you're not going to ever get well. So I mean, that's why I see these patients, because it's an ear, nose, and throat problem. Because a lot of them need sinus surgery. I'd say at least half of them do, and the other half you can clear up without surgery. And so the reason that they need surgery is because they're not improving on maximum medical therapy. With a good long trial, 2 or 3 month trial, they're not getting better, and they're doing everything right. So then that they need surgery to clean out the sinuses. So cleaning out the sinuses means you're cleaning out the source of making more mycotoxins for the brain. So all this in the sinuses is forming gases. The mycotoxins are like gases going into the brain from the sinuses. And so I can show you some pictures later on here of what it looks like inside the brain on artificial intelligence software.
Yeah, well, we
So-
just have about 10 more minutes left, so let's hop into some
Let's do that now.
videos or pictures that you'd like to share for cognitive health, because that's a big part of how we age, is avoiding cognitive decline, and some of these things might be good red flags for people to pay attention to.
And this is another example.
Patient Mark Anderson on 116.
See, that's severe Parkinson, and that's on maximum medical therapy. This is about a week after surgery.
It's post-op 3 weeks.
And this is
Yeah.
see. So he's back normal. So
Wow.
Patient Mark Anderson on 116.
So it wasn't Parkinson's, or it was Parkinson's
that was
signs
Parkinson's.
of part.
It's
that's
Parkinson's
after.
is caused by mycotoxins.
Wow.
Okay. So this is a typical, see, these colony counts are over 4, and these are the plate counts. So this house is really bad. All right. And so this
And
is
so
what,
you want, sorry to interrupt, but the plate count, what is, you want it under 4, you're saying?
0
Or
to 4.
0 optimally, but 0 to 4.
Now, if you got 4 plates and you got 4 zeros, that means you got 4 bad plates. Okay, so you're not going to get 4 zeros anywhere. That's not going to happen. So you're going to grow something. So if you got all your plates are clear, you got to get some more plates, because they're not any good. So this to the right is what we took out of these sinuses. See how much mycotoxin, all that brown stuff is mycotoxin coming out of this tissue in the sinuses. From this
So
fungus.
is that stuff that you drain from their nose and that's in a petri dish?
That is actually this soft tissue that we remove endoscopically at the time of surgery. That's tissue.
Tissue, okay.
Which is
Because
containing
that sinus tissue.
that's containing the fungus and the toxin.
Wow.
And that tissue is going up here, this thing called the brain. Okay. It's going from here right into the brain. So that's important to understand that. And like this guy he was in a wheelchair for 2 years. And then you only got 10 minutes. I'm going to show you some more. But now this is the first time we ever imaged mycotoxins. So we took all the mycotoxins in the lab, put them in test tubes, and we CT scanned and MRI scanned the test tubes. Then we had a bunch of patients we biopsied, and at the time of surgery, we biopsied a certain location, and we know the location where the toxin was because we tested the tissue from the nose and found the toxin in the tissue. So in this particular thing, it runs 7,000 algorithms in about 0.6 seconds until you can see something in that test tube. So the black stuff is the gliotoxin in this test tube. So we're looking for black stuff. So see the black spots in here? We've taken this out and we've assayed this tissue, and we know this tissue has gliotoxin in it. So we know that test tube has gliotoxin in it. So when we saw the black stuff, we know that gliotoxin is black, and that's the first time we were able to image it. So this guy had a colloid cyst inside of the left ventricle of the brain. You can't reach this with surgery, but he has severe headaches every day. And so he was urine positive gliotoxin. So this is a test tube of gliotoxin with a MRI scan. It's a white substance. It looks just like this when you just do a regular MRI scan. But when you take the MRI scan and run it through this algorithm, you see this turns out to be a blue stuff with red spots in it. And then when you look at this in the brain, it's blue with red spots. So we know that that's gliotoxin inside the brain, and the brain walled off that gliotoxin and created that cyst. You understand?
Yeah. It's just scary. I don't think people realize, your nose is attached to your face, which is where your brain is. And how we're afraid of brain health is just what's going into your nose cavity, nasal cavities.
No, but it's in your nose, it's in your brain, basically.
Yeah.
So
that's
if
what
you
I mean.
have a positive urine mycotoxin, you are 100% sure it's in your brain, okay? Because it went everywhere. So this is another test tube. The black substance is gliotoxin. And this is all the MRI show, these little white spots, these little infarcts. But look how much toxin she really has. All this stuff. This is a patient of mine who's a nurse, and she got rid of all this with neurotherapy. Now you have to use, we'll go over the treatment plan, but this is probably the most interesting one. This test tube is a black substance. It turned out to be gliotoxin in this particular patient. She had a pituitary tumor and from a mold exposure, and the pituitary tumor was growing large, and it was making cortisol, which made her Cushingoid. So she had Cushing's disease, and she had a over 100-pound weight gain in 3 months from this tumor. So I sent her to the endocrinologist and neurosurgeon. The neurosurgeon had to take that tumor out, or else the patient would die with the continued large amount of cortisol in her body. All right, so the neurosurgeon took this tumor out through her nose, and we took a piece of the tumor and assayed it for mycotoxins. So guess how many mycotoxins were in the tumor in the pituitary? 11. So this black substance here represents 11 or more mycotoxin in her brain, all right? And those are the mycotoxins in the pituitary. So when we took the tumor out and assayed it, we proved that the tumor was full of mycotoxins. So that's probably what caused it. Now this is the test. All these toxins were in that tumor. We did 2 different runs to make sure it was correct. And then this is her when I first saw her, and this is her now.
Wow. Just getting that tumor.
So this is more of all that black stuff is mycotoxins in the sinuses, and you can see it over here, all this brown, gray stuff.
Well, let's get to, sorry, you can, next, if we after this slide, maybe go into solutions. If people are curious to learn more of how not to have this or what they can do for treatment if they do have it.
Yes. So this is a normal MRI, doesn't show anything. This is what's really in that MRI. This whole brain is full of mycotoxins. And this patient did not want to have surgery. And this is with getting the toxins out of the brain without surgery. And what we did was, may want to write all this stuff down. Oxygen, 2 hours a day, 100%, you know, an oxygen concentrator. It has to be 8 to 10 liters a minute. It can't be 4. 8 to 10 liters a minute, oxygen. Don't get a used one, get a new one. You don't know where the used one's been, right? And then you go, then you irrigate the nose with saline, normal saline with an irrigator. All this is on Microbalance Health.
Okay.
Or if you remember that, it's sinus5.com, takes you to the same place on Microbalance Health. Or sinus5.com. And then you're going to do glutathione twice a day, 250 to 500, NAC twice a day, and then liver cleanse, which is a combination of, you know, 4 different herbs. And then the last one is called Intramax, INTRAMAX, but you want the one that says 2.0 unsweetened. Intramax 2.0 unsweetened. It's got 415 items in one thing, bound to carbon. So it works pretty well. So you do that, and then in the nose, you're putting amphotericin nebulization, and they're taking some oral antifungals. We started out with nystatin and dofequin to get rid of the yeast first, and then we can switch to itraconazole. You know, and that's itraconazole is taken 100 milligrams twice a day to start a low dose, and we keep them on that a few months. So all that is very successful at getting this stuff out, and so. All right, so this is a checklist. You can have a checklist.
Great.
You know, for no sugar in the diet. Make sure your air is right. Do tap testing to make sure it is. Make sure you don't have all this stuff. Now, a lot of these mold patients have Lyme's, Epstein-Barr, cytomegalovirus, all of it, you know, because they're immune suppressed from the fungus, and then they get all this other stuff. Usually they got a tick bit years ago, never got a problem, and then they got a fungal exposure. It lowered their immune system, and then they got the Lyme's. So then we do testing for MTHFR because if they've got cognition issues, they've got MTHFR, okay?
Mm.
Because they can't get rid of the mycotoxins. And then this is what basically get the environment fixed, fix the diet, clean the house, clean the clothes, and you get better. And this is what, let's see. This is what our treatment protocol is. If you want to shoot a copy of that.
Yeah, I'll do that when we post the video. We can take a screenshot.
Yeah, get a
And
shot.
so when you're doing the liver, the products that you guys have, the glutathione, NAC liver cleanse, and what was the other one? Intramax, is that through a nebulizer or how is the delivery system?
Orally. Take it orally. What you're doing in a nebulizer is amphotericin or voriconazole, which is a prescription drug, but you're using it. It's called a Rhino Sprint is the name of the nebulizer. That online. You put 2 cc's of that with amphotericin in it, and you close one nostril and sniff up hard when you actuate it. So you're sniffing up to get it into all the sinuses. And then when you're releasing it and turning it off when you're exhaling. So all the inhales are with the button down delivering the mist. If you exhale while you're doing it, you're just wasting it, you know.
Got it. Yeah,
So,
I gotta inhale it.
then you do the other side the same way. Then you get a result. That really works well, and it actually it's effective in killing it in the sinuses. And this is how we get it out of people. And a number of these people, at least half of them, won't need surgery if they do all this stuff.
So what are some signs and symptoms that you have this? I mean, is it runny nose? You're just always having stuffy nose, allergies, or is it brain? I mean, it could be all sorts of things. I'm sure there's a long list we can share.
Well, yeah, if you got stuffy runny nose and it's all the time, you got irritation there, and or you can have that with sinusitis, meaning you're getting a sinus infection. That you're getting green and yellow discharge. That's the sinus infection, and if you keep getting that, where is the fungus? Because you're getting fungus from somewhere. At least 93% of the time you're getting fungus, so you're only going to be wrong 7% if you just guess you have fungus with chronic sinusitis. So if you fix the air and fix the food, then you can get it out of your nose and it stays out of your nose. But trying to stay in the home that's contaminated and then doing your irrigation and your washes is like trying to dry off while in the shower.
Yeah, it does not work well.
Use like 25 towels and you just can't seem to get dried off, and you're never going to ever get dried off unless you get out of it. You have to get out of it. And that's the hardest thing for people to do.
Yeah,
they're stuck
for sure.
all they have these
That's many
psychiatric problems because they're losing all their stuff. And I tell them, look, just put it in a storage facility. You still have the stuff mentally. And then when you get well, when you're ready to get sick again, get your stuff out, And so then they understand they don't want the stuff anymore, but it helps them get over it,
But it's good to be preventative, as you're saying, like get this HEPA air filter, get the candles or spray mist as you're showing on the slide, the products why I reached out to you guys, why I got your website.
Yeah, these numbers are the
mailing
numbers for the fan and it's called a D6 stereoionizer. It's from Israel, and it makes no ozone and no hydroxyl, and it is equivalent to 6,000 CFM. So that'll work in a big industrial machine, not just a house machine. So you put that in your central system, and these 2 phone numbers you call to order that, and all the rest of it you can get on Microbalance Health or sinus5.com. So this is how you spray everything with this stuff or fog it, and the candles remove the mycotoxin from the air. In 3 hours in a 12 by 12 space, it's all gone from the air.
Wow.
With the candle. So see, this is before and after the plates.
Yeah, I need to do that.
So the candles are very safe. They don't have an odor. And then when you put them out, just put the top on it so you don't make smoke.
Mm,
Uh,
good point.
and when you take them to a hotel, you don't want to leave it. You can leave the candle going, but you got to put it in a place that's not going to cause a fire.
Yeah, minor problem.
Yeah, then you
Yeah.
have another problem.
But that's a good point. When you travel,
So,
airplanes, hotels can be the worst mold besides, your own house, of course, but hotels, I think are always a big problem, especially if people doing Airbnb
yeah,
places,
you can't
hotels.
canvas the Airbnbs, but some hotels have what they call clean rooms or allergy-free rooms, and that's what you ask for. And most of those are going to be okay. And you got to have the ability when you enter a room and you know it's bad, you don't stay there. You leave it. I tell people the universal password for getting another room is asthma.
Oh,
That's the universal password. I
got
got
it.
asthma. Give me another room.
Yeah,
Don't
there you go.
you're not gonna get any help. You get zero help if you say mold. Because
Okay.
when you say the word mold, you have reduced the recipient's IQ to a single digit.
So just say I have asthma.
Yeah,
Good to
yeah.
know.
Because
Good.
when you just say mold, the brain stops working. It receives no more information,
Mm. Okay. Well, we'll put all the links in the show notes. I think there's great information, and I think it's important to see the visual aid. I always find more powerful, and looking at the different products to help that. That's why a couple years ago I bought that sinus defense spray, and that's how I got on following your blog and learning more about the company. And I want to share this information with others because if you're struggling getting the results with, you think you're doing all the right things trying to be healthy, but mold can be obviously everywhere, and you great visual aids of how it gets into your sinuses and how your nose is connected to your head and your brain is in there. So we have to look at all these different random correlations. You might not put it all together, but that mold might be the root cause.
The place I like to use for mycotoxin testing is real-time labs. I like that one the best. There are other ones, and if you get it, that's fine. But I like them the best because they're able to do tissue samples and stuff. So
Real time.
you can go online to real-time lab, and you can order your own urine container and test yourself. And if you've got mycotoxin in your urine, you're in trouble and you need to get into a safe place and start doing all this stuff so you can get better. But if you're not really badly sick, you can stay in the house, but it's hard really to get the right company to do this. And that's why the two numbers I had on that previous slide are the companies. These two numbers, they're the companies that we use.
Okay.
Two different companies. They go all over the United States to they're professional remediators, but they also test. And so a lot of the tests you get are not worth much because the reason is the number they consider to be too high is too high for like a normal number is too high for most of my patients. So patients get sick a lot lower than what they consider to be an okay air. So that would require much fungus to get sick. So the numbers got to be much lower than that. Like some of these tests, it needs to be closer to zero, for some of these patients. And this thing is the iodine inside your central system.
Oh, interesting.
Yeah, and this is self-cleaning. That's the key. It's self-cleaning, and you don't want one that makes any ozone. Zero ozone and zero hydroxyl. That's important. If it makes any of that, you don't want it because it causes problems in the sinus mucosa. It knocks off the cilia. Ozone knocks off the nose and it destroys the cilia. So you don't want that.
Okay, good to know. All right. Well, I know we're out of time. Anything else you want to share with your mission and how we can learn more from you, or people want to get more information? We'll put everything in the links for sure in the show notes. But what else would you like to tell everyone? Your last message.
There's a website called Sinusitis Wellness. Sinusitis Wellness that goes along with microbalance, but it's educational. it's a lot of articles that are helpful for people that are written by people who really know what they're talking about. And that's a good resource for, just studying. And then the Microbalance Health has all these products. And these were designed, we had to design these for mold patients. And especially, we started off with the environmental products because there wasn't anything out there that didn't have something that was bad for you in it. So you can drink that stuff, it won't hurt you. I don't do that, but we have, somebody's going to drink it, right? So we had a lady drink 2 cups of coffee of that stuff and she was fine. She didn't, it doesn't really hurt you. So
Okay.
it has to be safe for children. I thought the children were going to drink it, but
These look good supplements, and the delivery, they're in capsules. They're not liquid.
That's
Liposomal delivery. Okay. And the bioactive binder, I would think, and I know we're out of time, but stacking that with a sauna to help detox, is that beneficial
That's
for mold patients?
that's right. Yeah. So all the stuff you're talking about is really good stuff. Sauna and all, but the oxygen is actually more important than sauna. And sauna is really good. Okay. But oxygen is more key. Oxygen gets it out of the brain more than anything on the planet. Then if you do hyperbaric, that's even better.
Yeah. I'll have to tell my naturopath they have a hyperbaric chamber. No one ever uses it. I said, well, you need to market, but that'd be a great place to target market.
The metal chambers are actually better than the plastic ones, but all of them are good. It can get to a higher level, and you use oxygen in the hyperbaric. There's a guy named Dr. Hirsch in New Orleans, and he does a QEEG with the hyperbaric to get the exact formula that the patient needs for their brain.
Yeah. And
So
I feel like I need all that. Like it feels like you need it just if you're a health optimizer, you just kind of feel like you might be there, but you don't want to get to that place that those other people, so getting ahead of it.
What a lot of people are doing, and I'm not saying this is wrong, but they got 3 or 4 doctors. They're taking 40 different supplements.
I know.
They're doing sauna, they're doing all this stuff, and they're missing the whole point. They don't have their air right, and they're eating sugar.
Yeah.
And so they're wasting all their money and time. It's not.
I know it.
You're guaranteed a 100% failure rate if you're not going to do that.
That is what I'm trying to tell people. It's, the root cause, you got to figure out what it is for you that you need to support and figure out why things are happening and investigate, test and not guess, and not just take all these supplements. You can't out supplement the lifestyle habits or the root cause of what's going on. As you said, putting more gasoline on the fire.
Yeah, so don't try to dry off while in the shower.
I'm going to start using that one. I like that.
You're
Well,
still in the
amazing. Yeah, that's a good one. Okay, so we'll keep all this up on the YouTube channel, Coach Debbie Potts, if people are listening, but you got to watch the video and lots of information and resources. So you have to go screenshot. If you're on, I use my iPad watching the YouTube video so you can get those protocols and check out the website to get the products if you want to get that. I think everyone should get the dishes to test rooms in your house, in your car.
Yeah, we got those QR codes so you can shoot the QR, then you got it.
Okay. Amazing. Well, thank you for your time and following your passion and helping others be healthy and help figure out what's wrong with them. It's amazing.
Well, you're welcome. Glad to do it.